Welcome! The virtual event will begin shortly. Let's get to know the virtual event environment. At the bottom of your screen, you'll see a row of icons, each with a unique function. Icons vary from event to event, so you may see some or all of the icons covered in this video. This is the Restore icon. It will restore all of the windows to their original positions. The video and slides icons allow you to minimize each window and customize your screen. Click on the group chat icon to connect with other attendees. The Q&A icon is where you can ask questions to the speaker or ask for technical help. Just type your question into the box and submit. You'll see a brief confirmation message when you do. Click on the summary icon to read the event summary and on the speaker icon to learn more about the event speakers. When you click on the resources icon, you'll find additional information pertaining to the event. And last but not least, if real-time closed captioning is available, use this icon to follow along throughout the event. If you have technical difficulties, here are a few tips that can solve some of the most common issues. If you don't see the video or hear the audio, try refreshing your browser. If you can't hear the presenter, verify that your speakers are turned on and the volume is turned up. The platform works best when watching on a computer or laptop, not on a smartphone or tablet. If you have a weak internet connection, try connecting directly to your router with an Ethernet cable. And don't worry if you miss something, because you can view a recording of the event later. All attendees will receive a thank you email following the event with the information you need to view the recording on demand. Enjoy the event!
Hello and welcome. I'm Karen Cafanteris, Associate State Director for AARP in Michigan, and I'm very glad you're joining us to today's presentation on type 2 diabetes. Some of you may have joined us 2 weeks ago for the presentation by Dr. A.J. Shaw on prediabetes. Today, we start a 4-part series on type 2 diabetes. I want to take just a moment to thank our partner, Peak Performance Physical Therapy. This is the second year we've collaborated with Peak Performance Physical Therapy to do a monthly health and wellness event. Peak Performance is based in the greater Lansing area with offices in Lansing, Okemos, DeWitt, and Holt. In today's event, Dr. Surae Eaton will talk about receiving a diabetes diagnosis and share with you the many complications that can occur in the body when you have diabetes. The next 3 events we have planned will take you more in depth about the changes you can make to prevent the complications that Dr. Eaton will talk about today, and possibly even turn your diabetes around and get you to a place where you're no longer considered diabetic. 2 weeks today, on June 3rd, we'll hold our nutrition and diabetes session. 2 weeks later, on June 17th, our session will be on making permanent changes. Change is hard, very hard. On June 17th, we'll be joined by 2 behavioral psychologists who will lead you through steps in order to help you make permanent changes in your life. And then on July 8th, we'll wrap up our series with a presentation on exercise and diabetes. If you're not registered for the rest of the diabetes series, but you want to register, you can find the link to do so on the AARP Michigan virtual events page, which you can find by going to AARP Michigan's website at www.aarp.org/mi and clicking on the virtual events link. On this virtual events page, you'll find not only the remainder of the diabetes sessions, but also other upcoming events and also events that we have held in the recent past that you can watch on demand. If you joined us before the event started today, you most likely saw the short video on how to navigate the virtual platform we're using. I want to point out 3 of the red circles, which are called icons, because they're important for you to use today. The Q&A icon is where you will submit any questions that you have for our presenter, Dr. Eaton. You can submit these questions throughout the event, and we'll be answering those at the end of the presentation today. The chat is where you can make comments and interact with other participants, as well as those of us who are working behind the scenes during the presentation. And the third icon is the resources icon. Click on this and you'll find the resources that are available to download for this session, including copies of this presentation in both English and Spanish. Today we'll be providing simultaneous Spanish language closed captioning for any participants who are joining us and would like to do so, to use it. I would like to introduce my colleague, Carmenza Milan. I invite Carmenza to the platform. Thank you. Carmenza is a native Spanish speaker and is joining us behind the scenes today to assist with any questions that are submitted in Spanish. Welcome, Carmenza.
Gracias, Karen. Estoy muy contenta de estar aquí con ustedes hoy. Para los que están aquí con nosotros de habla español, bienvenidos. Este programa tiene subtítulos en español. Y si durante el programa tiene preguntas, por favor escríbanlas donde dice Estudio Q&A. Esas son las letras que significan cuestiones y respuestas. También hay un botón, si no ve esa cajita, hay un botón rojo abajo que dice Q y A. Ahí es donde pueden poner sus preguntas. Puede escribir sus preguntas en español y le responderemos en español también. Otra vez, si tienen preguntas durante el programa, escríbanles donde dice Q y A y las pueden escribir en español. Muchas gracias.
Thank you so much, Carmenza. We appreciate you being here. Thank you. We appreciate you for helping us out today. All right, now I'd like to introduce everyone to our presenter for today's session, Dr. Surae Eaton. Dr. Eaton was born and raised in Lansing, Michigan. She attended the Lansing Public Schools, graduating from J.W. Sexton High School. She received her Bachelor's of Science degree from Howard University and her medical degree from Michigan State University. Go green. Dr. Eaton's been a family physician for over 37 years. She was employed at Sparrow Health System until her retirement in 2014. Dr. Eaton is active in the community and enjoys speaking on various health-related topics. She volunteers with AARP and the City Food Pantry. She is a member of the Delta Sigma Theta sorority and the Negro Business and Professional Women's Club, both which are service organizations. Dr. Eaton stays active playing pickleball, golfing, and doing yoga. Welcome, Dr. Eaton. Well, I'm very excited about today's presentation. You are going to share a lot of very important information. So I'm going to leave you now and let you get started.
Thank you very much, Karen. I am excited about being here today and being able to share information with you. So, diabetes, diagnosis and complications. If I were to put a subtitle on this presentation, I would call it The Potential Impact of Diabetes on Your Body from Head to Toe, with the emphasis on potential. Today, we're going to talk about type 2 diabetes, the diagnosis. What does it mean? What do I do next? And we're going to spend the majority of our time on the complications. First of all, we're going to take a poll. And the poll reads, I am very knowledgeable about diabetes. I know some information about diabetes, but I want to learn more. And I don't know much. We're going to give you just a few minutes to answer those poll questions. Good. I think there's a few more people, but I think we've got the majority say that I know some information about diabetes, but want to learn more. And that's why you're here today. 76% of you said you'd like to learn more. And I think that is just the most important thing about diabetes. First of all, let's talk about what is diabetes. How is it diagnosed? There's basically 3 ways that we diagnose diabetes. It's all done through blood work. The hemoglobin A1C is a test that is done in diabetics about every 3 to 4 months. You all should be somewhat familiar with that. It measures the percentage of hemoglobin proteins in your blood that are coated with sugar. Ideally, it should be lower than 6.5. If it is 6.5, that's a diagnosis of diabetes. The second way is a fasting glucose level of 126 or higher. And then thirdly is a glucose tolerance test, which we don't do as frequently anymore, but it's a test where you actually drink glucose water, and then they check your blood sugar about 2 hours later. And if it is over 200, that too is a diagnosis of diabetes. Pre-diabetes, on the other hand, is having an A1C between 5.7 and 6.4, having a fasting blood sugar of 100 to 125, and having an oral glucose tolerance test that's between the 140 and 199. And then a normal blood sugar, you should have an A1C of 5.7 or less, a fasting blood sugar less than 99, and an oral glucose tolerance test of less than 139. So that is how we make the diagnosis of diabetes. This next slide I like because it actually is showing sugar cubes in your blood system. Normally, we should have sugar in our blood. Sugar gives us energy. And on the first slide, you see a normal amount of blood glucose in the blood vessel. And on the second picture, you see an elevated number of those little sugar cubes. Now, I like to think of those sugar cubes, if you will, as damaging the lining of the blood vessel, where they hit against the lining, the walls of the blood vessel, causing disruption of the blood vessel, causing scar tissue, which can lead to narrowing of the blood vessel. That, coupled with fat in the blood vessel, causes narrowing and therefore decrease blood flow to your tissues. So what do I do next? What you do next is exactly what you're doing today. You're getting more information. Information is key, which is the most important thing I think you can do with diabetes, is just to learn as much as you can learn, whether that's through seminars, whether that's through classes, however you can get information about diabetes, that is what you do next. Karen mentioned the diabetes webinar that was done on May 6th by Dr. Chu, which was on pre-diabetes, but I think it was instrumental in letting you know what to expect with diabetes and what to do to get it under control. So today we're going to talk about complications from diabetes, or potential complications, that is. We're going to talk about how it impacts all the various systems in your body, from your cardiovascular system to your mental health, urinary, digestive system, from head to toe, as I said before. First of all, we're going to talk about the circulatory system. Decrease in the elasticity of the blood vessels in your system causes them not to contract and relax as they should. This, as I said before, can cause narrowing, impeding the blood flow that goes through the blood vessels, and causes decreased blood supply to the various organs. It can also lead to high blood pressure and damage to both the large and the small blood vessels in our body. We have another poll. What is the leading cause of early death among people with diabetes? Cardiovascular heart disease, kidney disease or failure, or metabolic problems? Whoa. Yeah, it looks like most of you chose 79%, 81% or so chose number one, which is the cardiovascular and heart disease. And that would be the correct answer. Cardiovascular system is comprised, of course, of the heart and all the blood vessels that stem from the heart. According to the CDC, cardiovascular disease is the leading cause of death among people with diabetes. People with diabetes are 2 to 3 times more likely to have a stroke or die from some form of heart disease than those who do not have diabetes. They tend also to develop more serious heart problems at an earlier age than those who do not have diabetes. Wounds and infections, of course, go along with our issues with blood flow, poor circulation throughout our body, where wounds don't heal as well if there's not good blood flow. So you were correct. The nervous system, also known as neuropathy, if there is damage to those nerves. Again, according to the Center for Disease Control, symptoms are more likely in people who've had diabetes for at least 25 years or so. So the longer you've had diabetes, the more likely you may develop this neuropathy. The most common form of neuropathy is peripheral neuropathy, and we'll talk about that here in a second. Also, the National Institute of Diabetes and Digestive and Kidney Disease say that up to 50% of people with diabetes have peripheral neuropathy, and more than 30% have something called autonomic neuropathy. And again, we'll talk about that here in a second. Diabetic foot problems. There are two main issues that can develop there. The diabetic neuropathy, where the nerves that go supply the feet are infected, and peripheral vascular disease, which goes back to the blood supply that is impacting the tissues. Kidney and urinary system. The diabetic nephropathy. Nephropathy means the kidney. If you can see this little nephron here, that is depicted in this picture. And this is a healthy nephron, where the blood is circulating through this nephron, taking out everything it needs to in terms of electrolytes, sodium, and it takes it out through the urine. This is a nephron that has been damaged by diabetes. And these little white flecks are actually protein that is leaking out of that nephron, and that protein is going into the urine. Oftentimes when you go to the doctor, they may ask you to leave a urine sample. And what they're actually looking for is protein in the urine, which can be an early sign of kidney damage. Diabetes certainly can also affect our vision. There's short-term problems and there's long-term complications. Again, the small blood vessels that you can see here in the back of the eye actually are bleeding a little bit and causing that blood to seep out into the retina. That can cause, over time, if it's not treated, can lead to decreased vision as well as even blindness. The digestive tract is also affected by the nervous system. It can cause something called gastroparesis. Gastroparesis is a decrease of the autonomic nervous system that supplies the stomach and the bowel. And what happens is that this slows down and it builds up the food and the fluid in the stomach that is not emptying out as it should. So what happens is it can lead to things in the body, like things like reflux. It can also lead to indigestion. It can lead to vomiting and constipation, weight loss. There's a number of issues that can be caused from this gastroparesis. You can get full sooner just by eating small amounts of food. Can also be associated with this. Sexual health and fertility. Now, diabetes can have an impact, again, on the blood vessels of the autonomic nervous system that controls our sexual function, our sexual desire, our sexual stimuli, and erectile dysfunction actually is more than 3 times common in men who are diabetic than those who are not. And it can occur even 10 to 15 years earlier than those without the condition. That usually gets men's attention when I mention the erectile dysfunction. Diabetes, however, can also have an impact on fertility, the ability to conceive or to get pregnant in both men and in women. This poll asks you, when I was diagnosed with diabetes, my doctor sent me to a diabetic education class. My doctor gave me some pamphlets and told me to change my lifestyle, or my doctor did not give me any resources. Oop. What happened there? Here we go. I think we lost our current poll. Okay, do we have the results of that one? Oh, we are all over the place on this one. My doctor did send me to a diabetic education class, 42%. My doctor gave me some pamphlets and told me to change my lifestyle, or my doctor did not give me any resources. So I applaud those who were able to do diabetic education classes, because as I told you before, education is key, and trying to get all the information you can is so important. So thank you for those who did do diabetic education. And For those who not get any resources, you're getting it today. And there are also some resources we have for you at the end of this presentation that I hope you will take advantage of. Diabetes can also affect the skin. You may not have thought that that was the case, but there are links certainly between diabetes and various skin conditions, anywhere from dry skin to psoriasis or itching. Skin tags are very common. There's another condition that you can see in diabetes called acanthosis nigricans. And what that big word means is that particularly around the neck or the creases of your body, the neck, the inside of your elbow, the skin can be very dark and sometimes wrinkly, or feels like there's lines in it. That is an indication that you're probably diabetic, or that you have something that we refer to as metabolic syndrome. Some of these things are just harmless skin conditions like skin tags. However, some of them can be certainly quite serious, like ulcers or fungal infections that one can develop as well. Certainly, calluses on your feet can pose a problem. Certainly, if they're develop into wounds, these things over time, if not addressed, certainly could lead to amputation. Metabolic problems. There's 3 metabolic problems that are significant. The first one is called diabetic ketoacidosis. Big, long word. But it's an acute, life-threatening complication that happens when the body can't use glucose for energy. So it starts actually to break down fat in your body. As it does this, it releases a chemical called ketones. And these ketones causes your blood to become more acidic. Sometimes you can detect these ketones in your urine. Again, we used to check urine at home, have people check their urine at home commonly to see if it had any ketones in it or if it was acidic. Within a few hours, this can lead to various symptoms, including things like just dry mouth, nausea and vomiting, stomach pains, up to the point of loss of consciousness and even coma. Without treatment, diabetic ketoacidosis can even be fatal. It is most likely to affect individuals who have type 1 diabetes, but it can occur in type 2 diabetes as well. Hyperosmolar hyperglycemic state is more common in individuals who have type 2 diabetes. And with this one, it occurs when your sugars are extremely, extremely high. Symptoms can be more gradual, and it can be manifested by things like dehydration, confusion, also loss of consciousness and coma. And if it's not treated quickly, it also can cause death. The metabolic syndrome refers to a constellation of conditions. It's associated with diabetes. It's associated with high blood pressure and obesity primarily. You can be diagnosed with metabolic syndrome if you have 3 out of 5 of the following symptoms: high fasting blood sugar, a high LDL, that's the bad cholesterol. I always refer to it as L for the lousy cholesterol. A low HDL, That's the good cholesterol or the happy cholesterol. It can also be associated with hypertension or high blood pressure, a large waist size due to body fat around the middle, and also high triglyceride levels in the blood. These risk factors all are associated with the metabolic syndrome and also include individuals who have low physical activity and obesity. Next, we are talking about mental health. How are diabetes and mental health related? Stress is a part of life, but if you're feeling stressed, you may not take as good a care of yourself as usual. Another common problem is what's referred to as diabetes distress. That means you're feeling discouraged, frustrated, or tired of dealing with diabetes every day. That may lead you to do unhealthy habits, such as eating unhealthy food or, skipping your physical activity. And all of that can lead certainly to depression. If you think you have depression, certainly get in touch with your primary care physician. The sooner you get treatment, the better. Ask your doctor to refer you to a mental health specialist who deals with chronic medical conditions. Join a diabetes support group, that you can find online. And I don't have a slide for this, but in this same category is what we refer to as a type 3 diabetes in some circles. It is associated with what's called vascular dementia. And it's dementia that is associated, again, with poor blood flow to the small blood vessels that supply the brain. And if those small blood vessels are clogged, then certain portions of the brain can die and not get adequate blood flow, therefore leading to memory loss. And that is categorized as a vascular dementia. Depression can be more common in individuals who get diagnosed with diabetes. And as I said, there is help, and certainly taking care of your diabetes is the most important thing to obviate this condition. In many instances, you can reverse your diabetes with a change in lifestyle. And as Karen has already alluded to, further programming on nutrition and diabetes, the physiologic way, the psychological way rather, that you can address diabetes on June 17th, and exercise in diabetes on July 8th. And on a couple of these, there's actually going to be individuals who will be presenting who have actually reversed their diabetes. So please turn into that. Our next poll is: over time, diabetes can affect all parts of the body and result in several complications. One part of the body or up to 3 parts of the body. And 100% of you got this one right. It can affect every aspect of your body, every aspect of your system. I think perhaps the things that I went over today certainly clarified that question. There's no doubt about it that diabetes can have an impact on everything. So our recap and takeaway as that diabetes occurs in a person with a person's blood sugar levels become too high. And we went over what those numbers might be. It can affect all parts of the body and result in several complications, some of which can be serious. In the short term, a person with high blood sugar, blood glucose levels may notice that they can feel thirsty or they can urinate frequently. And if this happens, they should see their doctor right away and see if they actually have a diagnosis of diabetes. Because without treatment, you can certainly have issues with confusion, loss of consciousness, and even death, as I alluded to before with the diabetic ketoacidosis and the metabolic disorders. So if you have any of those symptoms, it's important right away to get into your physician. In the long term, diabetes increases the risk to your blood vessels and to your nerves throughout the body. And the longer a person has diabetes, the more likely they are to experience side effects. So again, the ways to minimize the risks would be managing your blood sugar. It may be with insulin or medications, or it may just be with your diet and lifestyle changes. Boosting your overall health with these lifestyle measures, eating a healthy diet. Dr. Chu went into diet quite a bit in that May 6th presentation, and I again would encourage you to review that. Exercise is critical. When you exercise, you're actually pushing glucose into your cells where it can be utilized and out of the blood and into the cells. So exercise is critical. And then, of course, following the treatment plan of your primary care physician. Most important takeaways today is remembering that you can reverse your diabetes with changes. All forms of diabetes can disrupt your daily life, but a person who manages their diabetes has a chance of having a full and active life. Here are some resources that we're going to leave you with today. The American Diabetes Association's website, Diabetes Care, Diabetes Self-Management, Mayo Clinic, Forks Over Knives. There's a number of websites that you can go to for more information on diabetes and how to obviate some of the complications that may exist. Exercise fitness, that's free online classes that you can participate in. You can do right in the comfort of your own living room, and a lot of these, and a lot of them are free. National Institute of Health has one, as well as a lot of community activities offer exercise classes. And again, during this time of COVID, a lot of them are online and free. Knowledge is power, as I said in the beginning. So getting as much knowledge as you can about this condition will help you in the long run to control it. This resource list is going to be available to you in English and Spanish, as well as some handouts that I believe Karen will talk about at the end. I thank you for your time, and I hope that you learned a little bit about the complications, potential complications, that is, of diabetes, but going away with the information that you can control this. Thank you very much.
Thank you, Surae, Dr. Eaton. Very much appreciated. A lot of really excellent information that you just gave. And we have lots of questions and questions still coming in. So I am going to start asking those. Just a reminder to everybody, you can submit your question under the Q&A icon. Click on that and you can submit your question there. We do have some people submitting their questions in the chat, and that is fine too. I can keep an eye on that. So let's get started with the questions. Oops, all of a sudden my questions went away. Let's see here. There we go. All right. So early on, at the very beginning, actually before we started, we had a couple of questions that came right in. The first one was, does your pancreas become less efficient as you age?
Yes, actually, that can occur. However, the pancreas certainly produces insulin, and it has cells that are called beta cells. Those beta cells are where insulin comes from. And what happens in diabetics, particularly if their diabetes is not well controlled, is that those beta cells actually die off. And you may have been at a point where your diabetes was controlled just by your diet, and then you moved to going on oral medication. And then you may have gotten to a point where the oral medication wasn't as effective anymore, and you had to move to insulin. Usually that is an indicator that those beta cells are no longer functional and have actually died off. And so your requirements increase. It doesn't mean that everybody, as they get old, will develop diabetes, however. Oh, okay.
All right, excellent. Another question, at what A1C level does glucose start to impact vital organs? Is it anything that's not normal? Is it at any point that it's above what's normal?
Yes, but it has to do with the length of time that it's not normal. Okay, so if you have an A1C of 8, for example, but it's only 8 for that first time you check it, and then you've done some lifestyle change, some diet, some medication, whatever it took to get that number down within a short period of time. And when you check it again, you're less than 7, then you're less likely to have developed any complications related to that. So it has to do with the amount of time that your A1C is elevated. As I said in a couple of the slides, some things even as long as 20 years of poorly controlled diabetes is when you start to see some of the complications.
Okay, thank you. That's good information. So you mentioned that people can turn around their diabetes and get to their A1C and their blood sugar levels that they're now no longer considered diabetic. Is that everybody, or is there a point where it's not possible anymore?
Is there a point where you're not diabetic again? Is that
no, where you can't turn your diabetes around?
When I was talking about the beta cells in the pancreas, if you get to the point where your body has no further function of the beta cells, or those beta cells have died off, then that is a point at which it becomes more difficult to turn it around. So the key with diabetes is that when you're diagnosed, or when you're early on in the process, if you will, to get it under control before you get to the point of burning out your beta cells in your pancreas. Did that answer the question for you?
People should put in chat, whoever asked that question should put in chat whether they answered the question. But it did for me. So, one person asked if you would mind repeating what you said about metabolic syndrome and the specific factors that can cause it. Okay.
Metabolic syndrome is made up of a number of factors. One is obesity, particularly what we call truncal obesity, that obesity around the middle. It's also associated with elevation of your triglycerides, which are the other fat in your body aside from the cholesterol. It's also associated with the cholesterol, but specifically a high LDL or lousy cholesterol and a low HDL or good cholesterol. It's also associated with hypertension and diabetes, elevated blood sugar. So those 5 factors all feed into the metabolic syndrome.
All right, thank you. All right, there's a question about if you are on insulin for diabetes and can you reverse it and come off of it? You kind of answered this already, I think, but getting a little more specific than the other one.
Yeah. Again, it kind of depends on how long you've been diabetic, how long you've been on insulin. It refers back to those beta cells in the pancreas that I was talking about. Now, some people are put on insulin right away. Let's say, for example, you present with diabetes and your blood sugars are 500 or, very high. You may be put on insulin fairly quickly to get it under control. That does not mean, however, that you will always need insulin. Once you get that blood sugar under control, do the weight loss, do the, dietary changes, you can certainly come off of insulin. So it really depends on how long you've been on it. What's the time frame?
Well, it's good to know that it's still possible. So,
yes.
All right. So here's the question: should you start taking metformin if you're pre-diabetic?
That is a good question, and there is evidence that has shown that if you take metformin as a pre-diabetic or even as a diabetic, that it can actually prolong your life or actually have an impact on your decrease your ability to become a full-blown diabetic. So yes, there is evidence to show that metformin can be very beneficial in the pre-diabetic time frame, if you will. However, I would stress that if you are pre-diabetic, that the other things that we discussed in terms of the nutrition, the weight loss, to bring that A1C down as much as you can, it may not be necessary to even do metformin. And as I said, the workshops that are coming up in June and July will talk about that in a little bit more detail as far as the diet and exercise is concerned.
In the nutrition and diabetes session, we actually have someone who has done that, who has turned their diabetes around by changing their nutrition. So it's a really inspiring story. I encourage everyone to participate in that. And saying that, I had a couple questions come in about how do you register for the the rest of the events, and you can go to the AERP Michigan virtual events page, and they are all listed there. And you can find that by going to the AERP Michigan website and then clicking on the virtual events page. All right, and then we had a question about how safe metformin is, and she just talked about metformin, saying that they have read that metformin is not safe. And what do you have to say about that?
Well, it depends on your sources. Sometimes when you Google things, if you will, there's going to be a lot out there about metformin and the safety of metformin. By and large, metformin is safe. There are some concerns about long-term use. And again, I think it really comes down to how well controlled your diabetes is, either on metformin or they're on other diabetic medications. Metformin tends to be the first line, if you will, of medications that are prescribed for diabetes. And there are really good studies to show that metformin prolongs life. So I think that the jury may still be out. They're still doing research, if you will, on long-term effects.
I remember hearing one doctor talk about the fact that metformin is the oldest medication, and they have the most information on it, so they felt it was probably the safest out there because they have the most information on it. But I would guess that anybody can have detrimental reactions to any kind of medication, and all medications have some negative aspects to them.
Correct.
All right, there's someone asking about how to access the resources information. At the bottom of your screen, there are icons. There's one that looks like two pieces of papers put together, and if you hover over it, it says resources. You can click on that, and you can get those resources. You can click on them and download those. So, all right, next question. Can you suspect having or detect diabetes from the color or smell of your urine?
That's a good question. And the answer to that, in short, is yes. When I was talking about the ketones in the urine with kidney issues, ketones give you a particular kind of sweet smell to the urine. Sometimes people can detect the protein even in the urine just by the color, the dark color of urine. But the ketones probably are the most common that will give you a sweetness to smell to your urine.
Okay. All right. We have someone asking, what is a good reading for their blood sugar during the morning, the AM?
Your fasting blood sugar, which would be your morning blood sugar, you really want it under that 125. You want it as close to that 100, actually, as you can get it, but you want it under 125. Remember on the slide, 126 is the cutoff for diabetes, the actual diagnosis of fasting blood sugar. So the closest that you can get to a normal blood sugar, the better in the morning.
Okay. All right, and here's a question that I not sure about. It says there are different kinds of metformin. What about the different kinds of metformin? I didn't know there were different kinds of metformin.
There are extended release metformin and short-acting metformin. And of course, the dosage can be from 250 milligram tablets, 500 milligram tablets, 1,000 milligram tablets. So the primary difference with the extended release, obviously, is that it's a slower released. You don't tend to have as many gastrointestinal side effects. Like some people get pretty significant loose bowels or diarrhea with metformin, particularly the short acting, and tend to have less of a problem with the extended release metformin. Metformin can also come combined, actually, with other diabetic medications. Some of the newer formulations of metformin are combined with another diabetic medication that works in a different mechanism than metformin.
Okay. All right. Stan asks, can you describe the vision or eye impacts of diabetes? Are there symptoms that they'll experience or he'll experience, or are the eye symptoms only detected by a visit to the eye doctor? And I want to say that my husband actually was diagnosed because with type 2 diabetes because of a visit to his optometrist. They noticed something that the optometrist called bear paws or bear paw prints or paw prints in the back of his eye, and sent him to his doctor, who then diagnosed him with type 2 diabetes. He had no idea. So you could answer the question. That was just my 2 cents on that.
Yeah. Well, it depends on the how high your blood sugar is. I had mentioned in the presentation that you can get swelling of the eye where fluid gets collected around what's called the macula of the eye. That can cause blurred vision, squiggly lines, those types of things, and it usually is associated with a very high blood sugar. However, what Karen is talking about is when you go to your eye doctor and they do the slit lamp evaluation. I showed you that picture of the retina and how the little blood vessels in the retina had actually bled. And that may or may not be associated with anything that you can detect. You may not even know that's happening until you get that slit lamp evaluation, and they look in the back of your eye and say, hey, you got something going on back here that looks like diabetic, what we call retinopathy. So it can present either way, either with no symptoms or just symptoms that are picked up at the eye doctor.
Okay. All right, we have a question about do over-the-counter skin lotions or creams that are indicated they're good for diabetics really work any differently or better for diabetics?
I don't believe they do. I think a cream is a cream. The key with diabetes, as I told you before, dry skin is very common. So the key is keeping the skin hydrated. Okay. And sometimes that's just a marketing tool to, get people to buy the cream that says it's for diabetes. But I think any good lotion or cream that will keep your skin hydrated is sufficient.
Okay. All right, Carolyn asks, are skin tags on the neck and shoulders a symptom of diabetes? You kind of touched on this.
Yeah. Skin tags can be seen more commonly in people with diabetes. It doesn't mean that everybody who has skin tags has diabetes, however. Okay. Skin tags are very common. So the answer to that, I guess, is yes, it can be an indicator of diabetes, but it doesn't have to be.
good news. All right. So there's a question. I'm not quite sure I understand it. So maybe the person who asks it can clarify it. But the question comes in as, can gastrointestinal disease start off as unexplained nausea? I'm guessing they're thinking the gastroparesis from that you talked about during the presentation.
Yes, and I assume we're talking about in a diabetic or as a symptom of diabetes. Not all individuals who have reflux or indigestion certainly are diabetic, but the gastroparesis that I talked about is actually like a paralysis, if you will, of the GI tract, where the fluid in your stomach is not passing through as it should. So it just kind of sits there. And as it sits there, it can cause things like indigestion, reflux, feeling full when you've only eaten just a small amount. And it, again, has to do with the effect that the diabetes has on the nerve supply, what's called the autonomic or automatic, if you will, nerve supply to the stomach. So I hope I answered that correctly. If
Well, I would guess that this is when you would say, if you're experiencing that, you should go see your doctor.
yes.
All right. Let's see what else we have here. Here's someone who asks about when you have a fasting glucose is high, like over 100 in the morning, but then it goes down to the 80s between meals. What does that mean?
Well, I'm not sure if that person is diabetic or not. But if you have a fasting glucose that's over 100, then yes, you're either in that pre-diabetic range, unless you're over 126. Now, when it goes down, it implies that your activity level, what you've done, what you've eaten, has impacted that blood sugar. Most likely your physical activity. Because as I said, the physical activity, even, just walking around the house can cause that blood sugar to go into the cell and out of the blood, which lowers your blood sugar. Now, if you're diabetic and you're on medication that you take in the morning, then obviously your medication is kicking in, and that's bringing your blood sugars down into the 80s. So I don't know your particular situation, but those are two scenarios that could be occurring.
All right. I know we talked about this. You talked about this at the very beginning of the presentation about fasting blood glucose numbers, but there's a question about at what point should I become concerned about being too high or too low and see my doctor?
Okay. If your fasting blood sugar is between 100 and 126, you're pre-diabetic. You should see your doctor. If your blood sugar is over 126, you're diabetic and you should see your doctor. I feel that people should also have an A1C. Now, let's say, for example, based on that previous question, if your blood sugar is 102, but in the afternoon you're 80, the 102, typically it puts you in that pre-diabetic range. But you don't know what your blood sugar has been doing over time or at different times of the day. So the importance of the A1C is it gives you an idea over a 3-month time frame, really what your blood sugar has been doing. In fact, you don't even need to have the fasting blood sugar or the glucose tolerance test that I mentioned to you. Your doctor can make a diagnosis based on that A1C. So let's say again, for that person who was 100 in the morning and 80 in the afternoon, and you get an A1C and it's 6.0, then you are in that, diabetic range. Most of the time, also, I should mention, it's that the goal in diabetics is to keep that A1C at 7 or below. Most doctors will tell you that 7 or below is where they would like that A1C to be. Okay. Did I answer that question, Karen? Okay.
I think you answered it. If the person who asked that has any, further questions, they should put it in the Q&A or the chat, and I'll watch. So there's a couple of questions about neuropathy in the feet, and so and they are about whether or not that can be reversed. The complication of having neuropathy in the feet, can that be reversed? I'm going to guess the answer is no, because it has to do with your damage to the nerves, but I could be wrong.
Typically, the answer is no, because it does mean that the nerve has been damaged. However, the better your blood sugar is controlled, the better your symptoms may be. Oftentimes, if a person does have diabetic neuropathy, let's say you have burning or itching or pain, there is nerve medication that you can actually take that improves those symptoms. But it does entail taking another medication to deal with the symptoms. So the key is getting that blood sugar as well controlled as you can to help from it being getting worse over time.
Yes, that's the goal. We don't want it to get worse.
Yeah.
All right.
Yes.
Let's see. Alice asks about if you can discuss the difference between reversing diabetes and managing diabetes, which I think that maybe she just needs some clarification.
No, I think that's a great question. I think managing diabetes simply means getting your numbers, if you will, as close to normal as possible. Reversing your diabetes has to do with totally normalizing those numbers, where you're not on medication. I have heard it said that, once a diabetic, always a diabetic. And so you're always kind of managing your diabetes, okay? If you've been diagnosed with diabetes, even though you could be in the category of totally having normal blood sugars, normal A1Cs, your weight's down, your blood pressure's good, your cholesterol's perfect. Given all that, you are managing your diabetes, but you're managing it into a normal range. So it's kind of a play on words, it really.
Yeah. So you're kind of saying if you manage to manage your diabetes down to a normal range, it doesn't mean that you can just then eat what you want and not exercise and not change, not keep that lifestyle that you've went to in order to get it into the normal range. Yes?
Exactly.
Okay. Exactly. All righty. Question about several questions within one, but one of the questions within this is, do statins elevate blood glucose?
No.
Okay. All right. And let's see. Is there a danger of taking metformin or, I don't know if I can say this, atorvastatin for long term, like 7 to 10 years?
I'm not aware of a problem taking metformin. Atorvastatin, I think, is what the name is, which is a statin, long term. Now, with that said, it again comes down, especially in regards to the statin. It's felt that if you're diabetic, if you've been diagnosed with diabetes, as I said, cardiovascular disease is the number one killer, if you will, in people who are diabetic. And so if you're diabetic, if you've been diagnosed with diabetic, your doctor by and large is going to put you on a statin. And the reason they put you on a statin is to decrease your risk of the cardiovascular disease that we know can occur. It's recommended that LDL, that lousy cholesterol, be less than 70. Be as low as you can get that bad cholesterol. And most individuals, even with a good diet, have a hard time getting that LDL down below 70. Now, if you listen to Dr. Chu's presentation on a plant-based diet, or you look up Dr. Dean Ornish, they have been able to actually, a plant-based diet and Dr. Dean Ornish's program have been shown to reverse cardiovascular disease to the point where you don't need a statin. It's quite intense, and not everyone is open to doing that type of dietary intervention, but it is doable.
All right, and that's a great lead in to talk about the next session on nutrition and diabetes. One of the things that they'll be talking about is a whole food plant-based diet, and they'll be giving you some information about that, some recipes about that, and we are planning on doing a cooking class on whole food plant-based diet. So keep an eye out for that cooking class, but you can sign up for that nutrition session coming up. There's a number of questions about nutrition, about carbs and things like that, which I'm just going to say to the folks who asked them to please attend. So you can go back and watch Dr. Shaw's presentation from May 6th, where he talks about a plant-based whole food diet and about the types of carbs. It's much more important the types of carbs that you take in than the total number of carbs, because a whole food plant-based diet is not a low carb diet. It's all about the types of carbs. But so for those who are asking diet related questions, please participate in that event on June 3rd. And we have like one or two more questions here. I think we have one more question, and we will wrap things up here. And that is a question: are there any non-intrusive glucose testing methods that you know of, so they don't have to poke themselves?
Well, you probably have seen on TV the continuous glucose monitors that are available, various brands. The which is an excellent idea, I think. But the only problem is that I'm aware of, at least, is that insurances don't cover them unless you're insulin dependent diabetic. But that is available, and depending on your situation, you may or may not be a candidate to get one of those continuous monitors. That way you can just tell by your cell phone or whatever what your blood sugar is running. You'd need a prescription from your physician.
I've seen those commercials. So they make it seem like life is just peachy with that. All right, so I want to say a couple things as we wrap up here. Remember that we have other upcoming events that you can find on our virtual events page. Resources are downloadable from the resources icon here. Getting lots of things being posted about what an excellent presentation, very informative that you have, and thank you for answering all the questions. And then we would like anybody who used the closed captioning in Spanish, if you could put in the chat how you liked it. We would appreciate that feedback. So with that, is there anything that you'd like to say in closing, Dr. Eaton?
Knowledge is power. So I encourage you all to just get as much information as you can and get reputable information. As I alluded to before, sometimes you can Google things, go to Dr. Google and get all kind of stuff that is not scientifically based. Okay, so get reputable information and take care of yourself.
Excellent advice. Thank you so much. We appreciate your expertise that you shared with us, and we will see you next time.
Thank you.
Thank you.